My name is Jacqueline Sullivan. I'm the Deputy Communications Officer for Contra Costa Health Services. I'm so happy you have joined us today. And today we'll be discussing the new criteria for when Contra Costa plans to lift its health order requiring visitors to most indoor public spaces to wear face coverings. I'm so pleased to be here today with Chair Diane Burgis of the Contra Costa Board of Supervisors and Dr. Chris Farnitano, the County Health Officer. Each will give some brief remarks and then we'll dive into questions. We sent a media release about this morning, and you can find that at our website, cchealth.org/newsroom. And additionally, a video of this event will be available later today on Contra Costa Health Services YouTube channel. Links to both of those items are going to be posted in the chat shortly. Some housekeeping just to begin. If you'd like to ask a question, please put your question in the Q&A box you will see and not the chat. If you'd like to ask a question directly to Supervisor Burgis or Dr. Farnitano, please use the raise your hand button and we will unmute you. We're going to take as many questions as time permits, and we are allowing about 30 minutes for this conference. With that, I'd like to introduce Supervisor Diane Burgis.
Good morning. I am Supervisor Diane Burgis, Chair of the Board for Contra Costa County Board of Supervisors. You know, Contra Costa County, like all of California and across the world, was hit hard by another wave of COVID-19 this summer, but we're once again on the right track. But we're not finished with the summer surge. We have made enough progress that we now have a plan. We can tell you when most Contra Costans, and sounds like the Bay Area will be fairly consistent, when we'll be able to take off our masks when we all go out. And that time hasn't come yet. But I think people appreciate understanding the metrics that help us know when we can relax our use of masks. And I want to encourage people, even when you don't need to wear a mask as far as these orders go, please wear a mask. I know I will. To the great majority of our residents who are making healthy choices every day to protect themselves and the whole community, thank you. Whether you've been vaccinated, as 87% of us here in Contra Costa have chosen to do, or wearing a face mask, or just staying home when you feel sick, you are making a difference in helping us reduce the spread of this deadly disease in our county and across the Bay Area. We're working to protect the impacts that COVID has on our neighbors and our friends, our coworkers, and our family. We're working to strengthen our economic recovery by preventing as many disruptions as possible. And we're making sure our public health infrastructure is able to accommodate all we put on it. Dr. Farnitano is going to go and talk about the conditions we need to lift the health order that requires us all right now to continue to wear face coverings in most indoor public spaces. But before he does, I want to make it very clear, we are not there yet. And based on the criteria, it'll probably take a few more weeks before we should enter a store or a restaurant without a mask, assuming we continue this progress as we've recently seen. But we can now see the end of this particular episode in the pandemic if we keep making those healthy choices. And so with that, I'm going to turn it over to Dr. Farnitano.
Thank you, Board Chair Burgis. I'm very happy to announce that today the health officers for the 9 Bay Area jurisdictions that currently require face coverings in most indoor public spaces reached consensus on the criteria to lift those health orders. I and the other health officers in the Bay Area continue to work together to protect the public health with a consistent science-based regional approach. We have agreed that we will lift the indoor masking requirement in public spaces that are not subject to other state and federal masking rules when all of the following occur. First, the county or jurisdiction reaches the moderate or yellow transmission tier as defined by the Centers for Disease Control and remains there for at least 3 consecutive weeks. We are currently in the elevated or orange tier, the next highest tier. This metric ensures that rates are low enough to protect our most vulnerable community members when we remove the additional protection of universal masking. Second criteria is that the COVID-19 hospitalizations in the jurisdiction are low and stable in the judgment of local health officials. For Contra Costa County, that will be less than 75 COVID patients in our local hospitals, which is about where we are right now. This ensures that hospitals have the capacity to deal with both the current cases that they're managing right now, as well as the staff and supplies to deal with any potential modest surges that might occur if the protection of universal masking is lifted. The third criteria is one of two vaccination metrics are met. The first is that 80% of the county's total population is fully vaccinated meaning 2 doses of Pfizer or Moderna vaccine or 1 dose of the Johnson & Johnson vaccine. For reference, Contra Costa County is currently a little over 71% of the total population, including children, fully vaccinated. Or if 8 weeks have passed since a COVID vaccine has been authorized for use for 5 to 11-year-olds, and we're anticipating that may occur as soon as the end of October or early November. So if either 8 weeks have passed since vaccines are approved for 5 to 11-year-olds, or 80% of the total population is fully vaccinated, either of those would satisfy that third criteria. Now, this final vaccination metric is really important to ensure that enough of the community is vaccinated to give us a fair degree of confidence that removing the mask requirement will not trigger another severe surge of cases and hospitalizations like we saw that began in late June and July with the arrival of the Delta strain. It allows us to protect those younger kids either directly by giving them the chance to be vaccinated or indirectly by vaccinating most of the teens and adults that surround them. This allows kids to remain in school, not to have schools closed, or kids have to miss school because of isolation or quarantine. Now, our regional data is showing that the surge is now receding, and the Bay Area is one of the most vaccinated regions in the country. So it is time to really plan for our next phase and easing of some of these requirements. Each jurisdiction will rescind its order when the criteria are met in that specific jurisdiction or county. It's also important to note that there are still California and federal requirements for face coverings. That includes in schools and also folks who are not fully vaccinated, according to California requirements, must continue to wear masks in indoor public spaces. It's also required on public transit and in some health care facilities and adult and senior care facilities as well. So all those requirements would still remain in effect. And an important thing to note is that the FDA has scheduled a meeting to discuss COVID-19 vaccinations for the 5 to 11-year-old age group on October 26th. And so there's a possibility that we may get authorization from the FDA and the CDC soon after that. At this point, I'll turn it back over to our moderator, Jackie Sullivan.
Thank you so much, Dr. Farnitano, and thank you, Chair Burgis. We are happy now to open it up to questions. Please post any questions in the Q&A box and not the chat. And again, if you would like to direct a question directly to Dr. Farnitano or Chair Burgis, please raise your hand and we can unmute you. Any questions? We'll definitely wait a minute or two to give you time to write questions in the box. So far, we have no questions.
Jackie, we have someone raising their hand, so I will unmute them.
Wonderful. Thank you so much. Erin, who is your question for?
Thank you so much for taking questions. This would, I guess, be for Dr. Farnitano. Can you talk about, is there any likelihood of hitting that 80% without the kids? And are we basically saying, I mean, it seems like it's very likely these mandates will remain in place for presumably till the end of the year, if we're waiting for 8 weeks post FDA approval, and if you can't get there without the kids.
We are currently really doing a lot of outreach and campaigns to educate and encourage our residents who are currently still unvaccinated to make that choice to become vaccinated. You know, currently we have almost 1,000 residents each day who are continuing to make that choice to become vaccinated. So we are seeing 900 to 1,000 new first dose vaccinations in our county every single day. So if we continue at that pace, you know, we could reach that 80% mark within 2 or 3 months. And then if we have a significant number of children also get vaccinated once they are authorized, that could speed up that timeline as well.
So just to be clear, though, I mean, 2 to 3 months, it sounds like you could very likely hit that 8-week post FDA approval before you hit that kind of 2 to 3 months out for 80%. So it does seem like we're looking at masks for another couple of months at least.
Yeah, that is a reasonable projection based on, you know, our current trends. So we may be looking at, you know, December or maybe even January, depending on the timing of the FDA authorization.
Thank you. We do have another question about how long this order how long it will take for this to be implemented. And I believe you just answered that. Is there anything else either you want to add to the question, or I think you covered it, Dr. Farnitano? Is there anything you'd like to add?
Yeah, the only thing I'd like to add is hopefully this might inspire, you know, some of those folks who are on the fence about getting vaccinated. You know, the more folks who make that choice gets us quicker to that target and quicker to removing that mask requirement indoors.
I see another question. Thank you, Dr. Farnitano. We have another question. I'll read it. Broadly speaking, for nearly 2 years, we've seen cycles of surges of COVID infections. We react by tightening controls and things get better. We then relax controls and another surge starts to develop. How do we break that cycle?
I think that's a great question. And you know, COVID continues to surprise us and we continue to learn more about it. Many of us were fairly optimistic that in June, when the blueprint was lifted and the state masking orders were lifted, that we had enough of a vaccination rate in our communities to help prevent future surges. But then the Delta variant really surprised us. We know it was so much more transmissible, so much more contagious than previous strains. And the level of vaccination in our communities was just not enough to really keep that Delta wave at bay. We are hoping that getting to a higher level, getting our kids vaccinated or getting 80% of our entire community vaccinated. Many scientists do estimate that if we can get, you know, our community vaccination level into the range of above 80%, that will be sufficient to really keep the Delta virus at bay. Now, you know, the virus, COVID, may still surprise us in the future. There may be new variants that develop that may be even more contagious. So we will have to, you know, adjust as we learn more about how this virus evolves.
Thank you, Dr. Farnitano. We have another question, I believe, and we will unmute you now.
Hi there, thanks for taking our questions. I just wanted to know, this is for Dr. Farnitano as well, has there been any consideration of implementing something similar to what San Francisco announced today, where these indoor settings with smaller cohorts, you know, gyms, college classes, that sort of thing, might be able to lift their mask requirements sooner if every single person who is in attendance can verify their full vaccination status?
Yeah, we are aware of San Francisco's announcement to make those changes in the next few weeks, and we are reviewing San Francisco's decision and discussing it internally as to whether to make any similar changes, but no decision has been made yet at this time.
Thank you, Dr. Farnitano. We have another question. We will unmute you now.
Hello? Yes.
Go ahead.
Yes. So the three requirements have to be met for these to happen. Is that correct? I believe. The one question that I have is, there been a long time till the yellow tier, the color tiers were used. Don't you think that it's still going to be a little confused for people to go back, to use these and know exactly what that means? Can you explain a little more about that particular requirement, the yellow tier?
Yeah, it's a good question. After the state sunsetted the blueprint tier framework back in June, we really haven't been talking as much about different tiers and levels of transmission. So on our website now, we have a data dashboard we're going to start, and it's actually there as of today, showing what the current tier is according to the CDC. CDC's had these tiers for a while. We just haven't had as much discussion at the local level of these. The orange tier is very similar to what used to be the yellow tier the orange tier for the CDC was very similar to the red tier in the old California blueprint. And the yellow tier, which is where these new metrics are going to be focused on, is very similar to the old orange tier in the California blueprint, the second lowest tier in the California blueprint. So the criteria as far as cases is very similar. But it's a little bit different language. It's a slightly different color scheme.
Thank you, Dr. Farnitano. Do we have any other questions? If we don't have any other questions, please raise your hand. I want to give you an opportunity while we have Dr. Farnitano and Chair Burgis here with us. Well, if that's it, we'll go ahead and wrap things up. Thank you so much for joining us. Thank you, Chair Burgis, and thank you, Dr. Farnitano. Please, if you have any continued questions, visit our website. And again, this recording will be available on our YouTube channel. The links are in the chat. Thank you.